Hey guys, RB the RD here, bringing you the top 5 tips to help you survive general medicine. Depending on your program, you'll typically have general medicine as one of your first clinical rotations, and the patients found on these floors typically come from the emergency department. They're admitted to the hospital and then they need further evaluation and treatment, which means that you'll probably see a hodgepodge of different issues. Here's a few tips to help you come prepared and be successful. Number 1. Walk the floor and be familiar with it. Typically on each hospital floor, we have nourishment rooms. And these are little closet-like rooms that have snacks or nutrition supplements or other items that you might need. Understand where to find this and don't be afraid to ask a nurse for help. Number 2. Be familiar with the type of hospital food service you have and what you can and cannot change in a patient's diet. For example, can you add a snack? Can you change the consistency of their diet? Can you add a nutritional supplement? It depends on where you are and depends on your hospital. So be sure you know what your capabilities are before you go into the patient's room so that you don't promise them something and then realize that you can't actually do it. Number 3, be familiar with the medications that are most often used in your patient population. A good site to bookmark is uptodate.com. This is an evidence-based database that gives you all the information on medication treatment uses and interactions, so you'll go in feeling prepared and confident. Number 4, understand that not all weights can be trusted. Oftentimes, you'll go see a patient's chart, and in the last 24 hours, they've gained a significant amount of weight, or they've lost it. This might be due to fluid differences, but understand that it just might not be accurate. Sometimes when patients are weighed, we use a bed weight, and sometimes although we can zero it out the best that we can, it can be inaccurate. So use your clinical judgment and don't be afraid to question something if it looks kind of funny to you. Number 5, make sure to prioritize the biggest thing that you want for your patient before they leave the hospital. For example, if you have a patient that has type 2 diabetes and you go into their room and they tell you that they have a poor appetite and they haven't eaten for the past 3 days, your priority is not going to be carbohydrate education. Instead, it's going to be working with that patient to find something that they'll eat so that you don't have any unintentional weight loss or any negative consequences from that going forward. So, even if this means that you have to liberalize their diet, it might be for the best, seeing the bigger picture and hoping to get them home. Be sure to consult with your preceptor when you do this, but just understand that you're not always there to solve every problem, you're just looking at what is most important in this moment. So there you go. Those are the top 5 tips to helping you survive general medicine. If you like this video, go ahead and like and subscribe, and we'll continue to bring you everything that you need to get through the next month. Great job, guys. We'll talk to you soon.